episode 114, House Call Osteopathic Manipulation. I'm your host, Dr. Justin Trosclair, and today with Dr. Matthew Barker's perspective. Join 2017 and 2018 Podcast Awards nominated host as we get a behind-the-curtain look at all types of doctors and guest specialties. Let's hear a doctor's perspective. Thanks for tuning in. Before we begin, if you get a chance, go and write us a review on your favorite podcast app. That would be fantastic. All right. Today, if you're a physical therapist, chiropractor, an osteopath, maybe you're a medical doctor who's been interested in what we call spinal manipulation, aka the adjustment, aka osteopathic manipulation, then this will be the episode for you. We have a board-certified osteopath who chose to do his residency and his board certification in osteopathic manipulation. It probably looks similar to the chiropractic adjustment, but of course it's going to be different. And what also interests me in Dr. Barker is that he chooses to do home care. So he travels to your house, does what he needs to do. And so because that's such a foreign thing for me, I don't know a lot about it. I was excited to hear about it. How does it work logistically? How do you make it profitable? One guy's 30 minutes away. The next lady is, 45 minutes the other direction. So what do you do? How does that work? And then trying to figure out, okay, what is a residency look like for spinal manipulative therapy? What do the other medical doctors feel about it? Is it easier for them to refer to you? As a chiropractor, we're like, we want those referrals for all that musculoskeletal pain. Do they just go to the osteopath instead? How much rehab do they learn? What's the misconceptions that they have to deal with? What kind of marketing is he doing? A lot of those types of things are going to be answered today, including what EHR he uses and his favorite table for the moment. All right. By all means, you can go to the website, top right, follow me on any of the social media, like it, follow it. You'll see some cool stuff, cool pictures, the latest podcast, all that jazz. Like I mentioned before, parents are gone now, and let me tell you, I'm really proud of them. They're adventurous eaters. They usually aren't. They were really going with the flow. There's a lot more walking than usual. It's a different pace, obviously, in China. So really happy for them that they came and that they had a good time and that they were such easygoing and tried to make everything work. And they really appreciated what we did for them as well. So hats off to them. Love them, of course. And looking forward to hearing your guys' opinion. And ladies, of course, what should the next series be? Should I find a bunch of osteopaths of different types, see what they do? If you like that idea, send me a message, and I'll see what I can do. Okay, all the show notes can be found at adoctorsperspective.net/114. Let's go. Hashtag behind the curtain. Live from China in the Dallas area. Today on the show, we got a doctor of osteopath. He's got a little unique situation, so that's why we got him on the show. He's so good. His name is Dr. Matthew Barker. Welcome to the program.
Thank you. Thank you for having me on. I
was going on LinkedIn. I was looking for people, and I was like, whoa, an osteopath. Okay. I'd like to get some more of those on the podcast. We haven't really done that for some reason. And then I saw you do spinal manipulative therapy. And I said, whoa. That's pretty cool because I know you guys can do it, but it seems much more of like a side piece of most people's practice. But you're like, no, this is what I do. And not only do I do that, I do house calls. And again, I was listening to some PT podcasts and they're like, they do home visits. And, one of the problems they have is like, how do you even make this? It's not that efficient, but somehow they still are able to charge enough. So their salaries pan out as well. And it's a service for the people that can't really travel or just for whatever reason. So that's kind of the setup for why I wanted you on. But before we get into all of that, being that maybe you were into spinal manipulative therapy before you went to school, or you figured out you liked it while you were in school. But what's your backstory? How'd you pick osteopath and SMT?
Yeah, so I initially was interested in medicine and healthcare because I myself started having neck pain and headaches and low back pain starting around age 14. And so I sought out treatment. I went down the chiropractic and massage therapy route for treatment, and I did get some relief with those modalities. And I really liked the instant kind of relief that I got going in, and the idea of working with my hands and working with patients. And I was into athletics growing up, so I wanted to also treat athletes and kind of sports injuries. So my initial goal was actually to go into chiropractics. I did a lot of research at different chiropractic schools. I went to Arizona State University for my undergrad, and My specialty was kinesiology or exercise science. And I knew that osteopathic physicians could do or learn some manipulative medicine. But the ones that I knew that did it very little. And so it was not the predominant part of their practice. And so I wanted it to be the predominant part of what I did. And then I found out about halfway through my undergrad that as an osteopathic physician, you can specialize in manipulative medicine. And so you can do that full time and also provide injections when necessary or prescribe medications when necessary. And so I went and shadowed one. I went and got treated by one. And that's when I kind of switched routes from pre-chiropractic school to pre-med, and decided to go into osteopathic medical school, knowing that I wanted to eventually be board certified in manipulative medicine.
And that's wild. I mean, I didn't even know what a doctor of osteopath was when I was kind of in that same realm of, and I was like, wow, that would have been pretty cool because it would open doors that you otherwise wouldn't have. Like, chiropractors have a hard time getting into hospitals and, those types of things. And, we see patients, like you see, sometimes they need an injection. Sometimes they need medicine. It would be nice to be able to offer those things when you see like this person obviously needs more than what I can give them at this moment.
Yeah.
So what's the program like? Is it like a general practitioner? You just, after the school, you go to like 2-year residencies, or what does that look like for the audience?
So osteopathic medical school is very similar to traditional medical school. The curriculum, we have an almost identical curriculum in what we learn for general medicine and pharmacology and basic sciences. What's different in our curriculum is that we have our manipulative medicine class, which is usually in most schools 4-hour class once a week for the first 2 years of medical school. And in that class, we're learning how to evaluate and treat patients using our hands. And so we're learning how to look for restrictions and asymmetries in the body and tissue texture changes. And then you're learning a variety of different techniques to treat those with our hands. And then during the 3rd or 4th year, most schools require like 1 full month, so a full month rotation in manipulative medicine, working with a specialist. And then after that, besides that one difference, medical school training is very similar for osteopathic medicine versus traditional medical school. And so after medical school, which is 4 years, you're required to go to at least do 1 year of residency, which is called internship year, in order to get a license as a general practitioner. But if you want to be board certified in any specialty, whether it's family medicine, osteopathic manipulative medicine, or surgery, requires additional years of training, and that's called residency.
What are y'all learning? As chiropractors, we have classes almost every trimester. We got a lot of hands-on throughout the entire curriculum because that's kind of what we do. I mean, that's our bread and butter. So when you're in residency, are you starting to learn and do it like more hours per day as well as learning the pain management side? Are you considered kind of like a pain management specialist who also does SMT? Or how does that look? What kind of things are y'all learning?
Are you talking about for someone who goes on to get board certified in manipulative medicine, or the general osteopathic physician?
No, the board certified.
So the specialty training would come after medical school. And so part of the residency program to be board certified in manipulative medicine is 3 years total after medical school. And so you have to do a certain number of months with different specialists that work with the neuromuscular system. So we do some rotation with neurology, sports medicine, rheumatology, orthopedic surgery, a variety of different specialties, doctors that look at patients from a specialty perspective, that treat common conditions that we may come into contact with as an osteopathic neuromuscular medicine specialist. And then part of that training is also learning how to do injections, trigger point injections, steroid injections, platelet-rich plasma injections.
Oh, okay.
So we do get a variety of different exposure, and then you're also required to see a certain number of patients that are your continuity panel, and so you're managing them from a specialist point of view. we can prescribe pain medications, but more often than not, we let that be kind of separate. If someone does require pain management to be on opioids or something, most
Right.
of the time those patients are managed by someone who's board certified in pain medicine.
But that's nice. You get to have the PRP. You can do those other procedures. Y'all don't do microdiscectomies. That's going to be somebody else, though, right?
Correct.
Okay.
No invasive spine surgeries or minor procedures on the spine.
Okay. Do y'all learn much about like the rehab, or do y'all have to send out the physical therapist for that? What's that look like?
We do learn some. I mean, we spend some time with physical medicine and rehabilitation specialists, and so we do learn some of kind of the basics with rehab. But we don't have most osteopathic manipulative medicine specialists don't have like rehab in house, and so most of the time we're referring those patients to like physical therapy.
Now, do y'all yourself, since you're mobile, but outside of that, are they still in hospitals when you get hired as an osteopath who does the SMT, or is that going to be more private practice leaning? How does that look?
So, when you say SMT, that means spinal manipulative.
You like osteopathic. What's your phrase? I should have asked you that before we even started. What's your favorite phrase? Like the adjustment, the manipulation. What do y'all like?
You can call it manipulative treatment or osteopathic manipulative treatment.
Okay.
So we don't just address the spine. We treat patients from head to toe, and we do visceral or organ techniques, cranial techniques, soft tissue techniques. We do the high velocity or spinal adjustments. Okay. So just a more broad term would be like osteopathic manipulative treatment.
I wish we would say the same thing.
Yeah.
I guess that's why we just say it's an adjustment. But then the research, you look at the research, you just type in adjustment. You're like, well, that's not really going to show up anything. So, okay. So manipulative treatment. Yeah.
There are some hospitals that have specialist manipulative medicine consult services. The majority of those hospital services are ones that have residency programs for manipulative medicine doctors, because part of the requirement to become board certified in manipulative medicine is to see a certain number of hospitalized patients and do manipulative treatment on them. And so, for example, in the Dallas-Fort Worth area, the only hospital that has an OMM or OMT consult service is Medical City Fort Worth, which is where there's a residency program there for manipulative medicine. There's a few other hospitals in the country where, a 1 or 2 doctor group that are board certified will get a contract and have a consult service, but they're not very prevalent.
Are you finding that, for medical doctors that refer to a chiropractor, that's definitely something that we have to work on? Like we have to educate, we have to send papers, we have to send our case notes, really just try to get them educated, like, hey, we're safe. Hey, this is what the research shows. Hey, people get better. We're not all hokey pokey. There's a lot of those out there, but we're not all like that. Do y'all have an easier time getting relationships with the medical doctors to get these referrals, or how do you kind of position yourself?
I think, we have a lot of educating to do, because most people don't know what osteopathic manipulative medicine is. It's not a very well-known name. Yes, other osteopathic physicians would know about it and should be able to refer and know when to refer patients. But the general medical community doesn't really know exactly what we do and what kind of patients would benefit from our services. So we run into the same battle as you with that.
Okay. Do you ever regret going that route, being that there's more education, it's a little bit more of an up-road battle versus kind of patients just coming in like, hey, my back hurts, do something else with it?
Well, it's actually kind of exciting. It's something that I'm so passionate about that I love talking about it. So opportunities to go on, podcasts. I've done a radio interview. I'm involved with some of the local high schools in the Dallas-Fort Worth area for some mentorship programs. And I've gone and done, presentations for them. And I've gone with some of the local colleges and done presentations on what manipulative medicine is. So it's something that I enjoy. And then the coolest thing is getting a patient that doesn't really know what it is and giving them a treatment and just having them just be blown away with how much better they feel. That's a very rewarding thing for me. So I'm very happy with the route that I chose.
When you're having to describe to a client, potential patient, what do you do? How do you describe it? I'm kind of curious. I mean, maybe you have a long answer. Maybe you have something else you're like, I've actually mastered it. It's only a 20-second. This is what we do, and this is how you get better. So what do you tell somebody? You see somebody at Walmart, they're walking, and you're like, obviously, you should come see me as a patient. Like, what would you say?
So I'm a fully licensed physician, and what I do is I'm specialized in looking at your body for areas of restrictions, things that aren't moving the way that they should, and using a variety of different techniques with my hands to help them move better and help you move better, which can decrease pain, help with blood flow, help with your nerves to work better, your lymphatic system to work better, decrease your pain.
Okay. I'd like to cover this a little bit. What are some of the misconceptions about osteopath? And if you want to go osteopath manipulation therapy, you can go there as well. But, we all seem to have a black cloud sometimes over us, or just people just don't understand. Like, why would I go see you instead of just a medical doctor?
So I think, one of the biggest misconceptions or misunderstandings is most people that know that osteopathic physicians do manipulations, they think that we only do the exact same thing as what a chiropractor learns what to do. And so they may think that we only do the spinal adjustments. And so when I have patients that, have had back surgeries or have very frail bones, or someone that wouldn't be a good candidate for a high velocity or a spinal adjustment, they think that there's nothing that I can do to help them, but they don't understand that that's not the only technique that I use. I use such a wide array of techniques that are gentle enough to treat a newborn baby or a 100-year-old patient, yet I have other techniques that I could use that may be a little different on an NFL football player or somebody else that's an athlete. And so there's really not a patient that I couldn't find a variety of techniques to safely use on that patient. And most medical conditions that I can do something to help with osteopathic manipulative medicine. So I think that's the biggest misconception, is that people, they only think that we do one or two things, and they don't realize how many different things we can do.
Do y'all have your own legion of seminars to learn different adjusting techniques, or can y'all attend a chiropractic seminar to learn different types of techniques?
So we do have an academy. It's called the American Academy of Osteopathy. And so that's our professional organization for anybody that's board certified or that does a lot of manipulative medicine. That's kind of our professional association. And so the American Academy of Osteopathy does have an annual conference. It's like a week-long conference every March. And at those conferences, they have both lectures and hands-on workshops to learn new techniques. And then they offer a variety of different courses throughout the year across the United States. For example, I'm helping to teach a course that's coming to the Dallas-Fort Worth area in February, taught by Dr. John Tortu, on the viscerosomatic reflex treatment, which incorporates the meridians from Chinese medicine with osteopathic principles to treat both the organ and the corresponding musculoskeletal components at the same time within one technique. And so there's tons of course opportunities. Of course, any DO or chiropractor, can go to any kind of additional conferences. So I'm not sure. It just depends on the course requirement. So if there were like a chiropractic conference, if they accept osteopathic physicians or other kinds of specialties into those conferences, I'm not sure.
Oh, okay. Yeah, I would think, if you ran into some chiropractor, you saw some kind of technique, you're like, well, that's really cool, or YouTube video. Yeah, I would assume most of those conferences would be available to see. But what does visceral manipulation look like?
Well, it looks like a lot of different things. There's because it depends who's doing it. There's a lot of osteopathic physicians in Europe that have developed a lot of what today's like modern visceral or organ manipulation. So there's a lot of more direct palpation. There's indirect treatment of the organs. The visceral somatic reflex course that I'm helping to teach is really interesting, where you're palpating the organ and then treating along the meridian for that corresponding organ to create a release of the structures all along that meridian.
We're talking like fascia?
Yeah. So the meridians travel along like fascial lines. And so you can treat those corresponding musculoskeletal structures along that line.
Ah, that's interesting. I'm going to have to YouTube that later, because I would like I'm picturing it in my head. I'm like, obviously it's not going to be some high velocity thrust or something in that area. It
No,
feels
it's
like
very
it'll
gentle.
be, yeah. So it's kind of like a massage, or a very specific massage. Is what it might look like to a patient.
Yeah. Sometimes for that particular technique, we're sometimes moving the limb, because a lot of the meridians travel to the distal points of the hands, feet, and onto the face. And so we're actually moving around the arm or the leg, or turning the head to adjust that, or to treat that meridian precisely.
Okay. Treating the meridian. Is that with like needles? Is that like a finger, or what does that look like?
It's through manual palpation. So
Manual palpation.
yeah. So for example, you have the large bowel meridian, which terminates onto the hand, and then it does go onto the face as well, if you look at kind of the meridian chart. And so if you palpate along the large intestine, and you're feeling, in the belly for areas of tension, things that are not soft that should be, and you're along any part of the bowel, so the ascending or descending or transverse colon or rectum, if you palpate any part of that large intestine that doesn't feel soft as it should, then you can monitor that location with one hand, and then palpate anywhere along that meridian. So a common place for that to be triggered is where that meridian crosses the wrist, because of common, falling onto an outstretched hand, or having your wrist, become injured in some other manner. And so if you palpate along that meridian, so that you can actually palpate a change at your other hand at the location of the organ, then you're on a specific point that you can then treat that whole entire meridian. So it'll kind of release the fascia between where that point you found on the wrist and all the way to the organ.
Wow. Watch out. Obviously, I was curious about that just from the questions.
Yeah.
But that's really interesting. Okay. Now, what made you choose home visits? Switching gears here. How is that working for you? What does that look like? Is it an all-day affair? Give us a little rundown on that.
So currently my work situation is I have 5 months left to complete all of my requirements for my board certification in both family medicine and osteopathic manipulative medicine.
Okay.
And so in 2016, I got my general practitioner license to practice medicine, and I still had all my requirements left to get board certified in both family and manipulative medicine. And so that's what I call my day job, mostly Monday through Friday, 8 to 5. And I wanted to start my own practice, which I started in 2017. It's called Mobile Osteopathy. And my practice, since I'm only available to see patients in the evenings and weekends, I was trying to think about the best way to set up my practice. And I could have rented some space and tried to get patients to come to me kind of at odd hours, but I thought it would be better if I could just do house calls, so turn my disadvantage of not having time to see patients during normal business hours into an advantage. And so now I can market to a very large geographic area, because I can go to one part of town one day and a different part of town the next day, and see patients after I finish up my day job, and then see patients all day, like on a Saturday, for example. And it allows me a lot of flexibility. Patients are pretty, they're okay with a 30-minute time window if I'm coming to their home, versus them having to come into the office. And so it ended up being really good for me because the patients love it. I mean, I'm getting a lot of patients that are busy professionals, or I treat kids that are in school, and so people aren't having to miss work, people aren't having to get taken out of school, and then I end up getting a lot of new patients just because I'm there in the home treating one family member, and the next time they say, hey, next time you come back, why don't you treat this other family member too? And so I'm treating 3 and 4 people or entire households just because they're seeing what I do and that their family member is benefiting. So that was my initial model, was just doing 100% house calls. And as I've gotten busier, I've had to actually rent some space part-time. And so I do rent a room now inside of a Pilates studio that I use one evening out of the week and one Saturday a month. And part of that reason, besides being busy, was I've gotten a lot of patients that will call from outside of my house call radius, and they want an appointment. But since they live too far for me to travel to, I didn't have a place that they could come to. So now I've solved that problem by having some options for some office time.
And that office is sort of, you start hearing a bunch of phone calls from the Gainesville area or something. So you're like, oh, okay, let me get an office kind of in that general area so that they drive 30 minutes down and they're there.
No, I have an office that's in the Dallas-Fort Worth area that's within my service zone that I already, travel to.
Okay.
And so that way now I have an option for patients that live outside of my travel radius that can come to me.
Gotcha.
And so that's worked out well.
Do you have to carry special liability insurance or malpractice to do home visits?
No, it's included whether I see a patient in the office or in their home. My policy is the same.
Okay.
I do, for the office that I rent, I have to have general liability as well as my malpractice liability, but that doesn't carry over to the house calls. I think it's just the malpractice at the house okay. visits.
One, does insurance cover manipulative therapy for you guys? And then also doing home visits, are you taking cash only? Is it a mix of insurance? How does that play out?
So I take cash only. I'm just out of network with all the insurance companies.
Okay.
And so I provide my patients with the super bill that they can submit to their insurance company for reimbursement. It just depends on whatever their out of network coverage is. Generally, most insurance companies do pay for manipulative medicine. It's considered a procedure just like an injection would be, or a skin tag removal. It's just a different procedure code. And it's coded based on the number of body regions that you treat. So anywhere from 1 body region up to 10 body regions.
Like 9941?
Yeah, there's like several different codes, depending on how many body regions you're treating. So most of them do cover it. I'm just considered out of network. Now, as far as house calls, I think most of the insurance companies, if you use the house call code, that there's supposed to be like a medical reason that you're doing a house call.
Right.
And so there could be some issues with that if you're just doing it because you don't have an office.
I don't feel like driving to the doctor's office doesn't count as a reason for a home visit.
Yeah.
Fee. Okay. Do you get to charge an extra fee for your travel, or is that just kind of included in the prices?
So when I set up my practice, since I didn't have an office space, and even now, actually, I charge the same price for the office visits that I do offer and the house call visits that I offer, as long as they're within my travel radius. Mm-hmm. And I just calculated that into my cost, the fact that I don't have, a building overhead that I'm having to pay for, but my house call practice prices are pretty much the same as what I would do in an office anyways.
Okay. Do you bring your own tables everywhere you go? Anything like that?
Yeah, my trunk, believe it or not, is like the perfect space for everything I need. My manipulative medicine table fits in there just right. I've got a bag that I carry into the home that has, equipment to measure vitals, to an otoscope or ophthalmoscope. I've got a little binder in there with some handouts in it. And then I carry one other tool that I use sometimes. It's called a percussor.
Yeah.
Yeah. I
Yeah, it's
don't take
common.
that into every house. And then I do have like a rolling stool that I carry in the house with me to sit on.
Okay. Do you like the table you got? Would you buy it again?
Yeah, it's been pretty durable. I got it from ommtables.com, and it's actually designed to withhold more compressive forces, and its body is titanium or aluminum, so it's a little more sturdy and lightweight. So I've been happy with it.
Okay. Oh, and what software do you use? Electronic records?
I do. I use Practice Fusion, and then
Oh,
I
okay.
take my iPad Pro to do my charting.
How did you like Practice Fusion? I want to say it was free at one point and it was internet based. Is that still the option?
It's still internet based, and it was free. They started charging for it a couple months back.
Wow, that's it. A couple months. That's cool. Are you happy with it? Would you recommend it to anybody else?
For my purposes, it's fine. I don't know. I don't have to utilize a lot of the features because I don't do, billing through it and things like that. And I'm not using it currently for like appointments. So for what I'm using for, it's great. I haven't had any problems with it.
Okay. That's a very common question people have in our Facebook chiropractic groups. Hey man, I'm finally upgrading, or I hate the software I have. Who should I use? So, and then how do you set up your geographical area? Like, I'm not 100% familiar with the Dallas Fort Worth area, but let's just say, I don't know, the Northwest area. And you're like, okay, somebody calls and you're like, yeah, I only go on Mondays to this area. And then is that enough to get results if you can only go once a week?
So I chose my area based on where I live, and then also where I'm most frequently located during the day. So like where my day job normally is. So I live in like the North Fort Worth area, and then I work in like the downtown Fort Worth area. My goal was to, at worst case scenario, drive an hour or less to get home from any appointment.
Ah.
So that's kind of how I set up my radius. Was based on just drive time of how I wanted to manage my drive time. What was your other question with that?
I don't know, but I do have a follow up based on what you just said. So I'll go with that one.
Sure.
All right. You got somebody in the radius. How many people can you really see after work? Because one, you got to drive. That could be 10 minutes. The next person could have been seen maybe because they're only like 5 minutes from that house, but they're not available but for another hour. So how do you manage all of that? Do you end up wasting a lot of time, or is it you just find people that can fit into your schedule? How does that play out?
People tend to be a little more flexible in the evenings, and so I haven't really had too many problems of having to wait around, in between appointments. I do pay a lot of attention to scheduling people kind of in either in the same area or at least in a trajectory to get back to my house if I'm going to see them on the same day, so that I'm not backtracking. But I've been able to do a pretty good job at that. I do see between 10 and 20 patients a week right now. Yeah, luckily I haven't had too many issues with waiting around a long periods of time. Sometimes I'll get out of my day job earlier than I anticipated, and so a lot of my patients have been okay with me, coming early. I just call them, say, "Hey, I finished up early. Are you available earlier?" And so I can easily move patients around. My patients have been very flexible with that.
And like you said, if they're the type of person that will want a doctor to come to their house after hours, they probably have that flexibility to where if somebody comes up, you can say, hey, actually, can we switch this appointment? Or it's 5:30 is better for me. Oh, okay. We'll be sure to make 5:30 work instead of the 7 o'clock that I was hoping for. Correct?
Yeah. They've been people are really flexible with the house calls just because, you're doing them an extra convenience. And I do remember your other question. You were asking me, what if I can only see a patient once a week, if that's, problematic.
Yeah.
So typically I will see a patient for the first 3 visits spaced apart from each other between 1 and 3 weeks. So I don't really ever see anybody more frequently than a week. and usually 2 to 3 weeks between those first couple of appointments. And then I would say, 90 to 95% of my patients after that third visit, I kind of revisit what their goals of treatment are and what relief they've gotten with the treatment. And most people at that point are getting relief and feeling better. And so we just start spreading the appointments out more. My goal is for my patients to see me as little as possible while getting the max benefits. And so for some patients, if it's an acute injury, they may only need to see me 2 or 3 times, and then they're back to their baseline and happy. And so then they just call me the next time they, injure themselves. And for other patients that have like a chronic condition, degenerative disc disease, or, they have scoliosis or some other anatomic problem that's going to set them up for pain down the road, they may benefit from some kind of, maintenance treatment. And that can go anywhere from every 3 weeks to every 3 or 4 months. So it's very patient dependent.
Okay. Do you get patients house calls like something like sciatica? As a chiropractor, we're looking at, say, sciatica or like really bad headaches. And I'm like, man, if I got to see somebody once a week, it takes a while for them to really get the maximum benefit versus if you see them once or twice a week, maybe 2-3 times a week, in about a week or two, they're like, boom, you hit it hard, you hit it fast. That's kind of our little philosophy. You hit it hard, you hit it fast, they get better fast, and then, drop them down to some kind of maintenance based on what they need. But is that common in what you've seen?
So I haven't found that I needed to treat patients that frequently, and I don't know any osteopathic manipulative medicine specialist that see patients, especially more than once a week, but even once a week is not very common. And I think what allows, a patient with sciatica or headaches or so forth to get longer lasting relief is we're, treating the bony joints, the ligaments, the fascia. We have techniques to kind of calm down, muscle spasms or things of that nature. And so patients don't need to get treated as frequently.
That's very good. Okay. What kind of marketing? Do you do any marketing? What do you do?
Most of what I've done is actually just, talking and educating other people in the healthcare industry. And so meeting with potential referral sources to learn about their services and tell them about mine. And I started doing that early on in my practice. And I'm doing a lot less of the reaching out at this point because I'm pretty busy seeing patients. I'm booked out about 4 to 6 weeks right now. So
wow.
I haven't been able to do as much of that lately.
Have you ever thought about hiring somebody to help you out?
Yeah, I've been trying to hire someone for the last year, actually.
Come on, what's going on?
So, unfortunately, there's not that many people with my training, and so far, none of the people that do have the right training want to do house calls. So, still looking for the right person.
Yeah. What's their common complaint to not want to do home visits?
I don't know.
Okay.
I'm kind of like a rare person that I really don't mind doing like house visits. I grew up doing some door-to-door sales. I did that as in my youth. I served a proselyting mission, which was a lot of door-to-door and talking to people on the streets. And then I also for several years had an alarm business that I did door-to-door sales. So I'm very comfortable going into people's homes.
Yeah.
So I wouldn't say I'm like the typical doctor.
Okay. Yeah, because I guess you could probably see some really messy people in some weird situations. Or how do you have to run into, the doctor touched me the wrong way, and then you get sued for some kind of sexual harassment type of stuff because nobody else is there?
You take that risk no matter where you practice, unless you have somebody in the room with you at all times.
Mm-hmm.
So even if you have a practice location, unless you have someone in the room with you at all times, someone could make the same claim.
Okay.
As if I'm at the home. The only thing that you do have to your advantage in an office is if you do feel uncomfortable with the patient or kind of coming off weird, you can pull someone into the room.
Yeah. Hey, come
So,
here.
so it is a little bit more of a risk, but I've had great patients, and I haven't luckily run across that. There are some, additional things that you can add on to your malpractice insurance to protect yourself more in that regard. But luckily, it hasn't been an issue, but it is a risk no matter where you're seeing patients, unless you have someone in the room with you.
Okay. And any 5-year goals that you're looking forward to?
So I would really like to have like a wellness center where I'm doing osteopathic manipulative medicine, doing injections, PRP, stem cell injections. I'd love to have like a massage therapist in house, a dietitian, nutritionist, a psychologist, kind of have a multi-specialty center. And I'd still love to find other doctors that are willing to do the house calls, as part of my practice, so I can still offer that service.
Is there a hotbed of your board certification somewhere in America? Is there a spot where they'll tend to accumulate in the country? Does that make sense?
Yeah.
I would think Dallas, because y'all have a school that can do it. So it makes sense. We just never left.
Yeah. Unfortunately, there's not a ton anywhere. So, it's a great field to go into if you're interested in, this kind of specialty for people that are in medical school, because there is a high demand for board certified manipulative medicine doctors to work at the medical schools. And there's a high demand for it from patients too. So it's a very easy arena to grow a patient base in.
Do y'all have a website where you have a listing? So if I lived in New Orleans or if I lived in Chicago, I can say, oh, wow, there really is only like 2 in the whole area.
So one place that I'll direct patients to is the Cranial Academy. They have a website because not all doctors get trained, not all osteopathic physicians get trained in cranial treatment. And so typically only doctors that do a lot of manipulative medicine, whether they're board certified or not board certified in it, but they do a lot, will become a member of the Cranial Academy. And so they have a find a physician panel. So that's a pretty sure way of finding somebody that does a lot of manipulative medicine. You can, you can find them other ways. There are other search engines out there for, find a doctor that does manipulation. But I know that there's a lot of doctors on those searches that don't do very much manipulation.
Sure, I can do a manipulation.
Yeah, so
I do 3 a week.
I think if the safest bet for finding somebody who does a lot of manipulation is finding somebody who does cranial treatment.
Okay. And what is your website, or how do people get in contact with you if they want more information, Dallas area?
Yeah, my website is www.mobile- like the minus sign, osteopathy.com. I'm also very active on social media, so I have a Facebook business page, Mobile Osteopathy PA, and then I have a Instagram account at Dr. Matthew Barker. You can follow me on those. I post interesting medical facts and updates and practice updates of what I'm up to with mobile osteopathy. And then I see patients in the Dallas-Fort Worth area, and then also in Midland, Texas is another location, which is about 4.5 hours from the Dallas-Fort Worth area.
Okay. Before we let you go, any favorite books, blogs, or podcasts that you like to recommend or think people should just definitely check out? It's like left field at this point.
a great book would be Dr. Robert Fulford's Touch of Life. Dr. Fulford was a very well-known osteopathic physician. The reason why I like that book is that it really talks a lot about the osteopathic philosophy and what osteopathic manipulative medicine is, but it's under, kind of written more to the general public. as opposed to like a medical textbook.
Very good. Any closing remarks before we end the interview today?
No, thank you so much for having me on the podcast. Appreciate it.
Absolutely. Really appreciate it. I hope I think the audience will like it. We have a lot of physical therapy and chiropractors as a base audience, and to learn more about what you do and how all three of our paths are kind of blended together.
Yeah.
And then, following up with a little more of the details on how you actually make this thing profitable, as well as making it work logistically. So you tweaked my interest. I know people are going to be interested in it, and I really appreciate your time today.
Thank you. Yeah, have a good day.
Well, that wraps up another episode. If you can, send me a review. That's .net/subscribe, Apple, Google, Stitcher, Android devices. You just click that button. It'll take you exactly to the page you need to. You can write a review, hopefully a 5-star review. Like I said, it does help for other people to discover what we're doing here. And one thing I haven't really talked about too much is the adoctorsperspective.net/support page. If you want to host a cup of coffee, go for it. If you want to pledge a little higher fee, there's buttons for that. There's even monthly recurring for those who feel like, wow, this is like the cheapest mentor coach program I've ever seen, because you interview so many different kinds of doctors, and I've been able to implement things that I've heard and it works. So monthly recurring payments, which also can get you my books for free, t-shirts for free, the first book, that deals with health and exercise, getting on a diet, getting your financial health in order as well, things I've learned in China. That book is available as well. And one thing that I don't have like a full-blown page about coaching and things, but there's a little button there. I've had people request, hey, doctors and non-doctors asking me, can I do more than just answer a couple of questions? Or could you be my coach for a little while? And I say, yeah, we can do that. So it's something I haven't really advertised, but it's something that I can do, whether it's marketing, some strategies for new patients, growth, those types of topics. If you're interested, just email me, justin@adoctorsperspective.net. If you have any ideas for guests, please send me an email, justin@adoctorsperspective.net. I'd love to hear who you think would be good, or a profession that you may not have heard yet. And we've got over 100 episodes. This is going to be like our third year. Super excited. We're going to have little mini-series like we've been doing, which has been fun. Hope you've enjoyed them as well. That's the feedback I've gotten. I want to remind everybody that we have some great affiliate links available. If you're into instrument-assisted soft tissue manipulation, we've got the Edge tool, and we got the Hawk grips. Saves you about 10%. Also with the Edge, you've got the blood pressure cuff restriction system. You've got the G Suite inexpensive EMR in case you'd like doing cash practice. And of course, I got my own electric acupuncture pin to go with the no needle acupuncture book. From time to time, I'll have a bundle set where you can get them all together for a great price. I also have the free downloads at doctorsperspective.net/blueprints. And what lately I've been doing is substituting a fifth one. Like I've done a knee, and depending on the guest, I might do a different type. So check back there. You've got the Primal Paleo grass-fed protein, bone broth style. Save 10% on that. No sugar, allergy-free, gluten-free, dairy-free, all those types of things. Mentor box, get taught by the author. We got set for those floss bands that you may have heard about on one of the episodes. I really like those. If you want to know what hosting I use for podcasting, it's Blueberry. Pure VPN, that's one of those ones I use to help keep my payments secure, as well as access the internet more safely. Any Amazon products that you might want, click the link in the show notes pages. So all those resources can be found at doctorsperspective.net/resources. There's also t-shirts at .net/t-shirts. Put up some new designs from time to time, like making lemons out of lemonade, shrimp po' boy, plus all the chiropractic and podcast swag that you could want. As always, listen, critically think, and implement. Have a great week. We just went #behind the curtain. I hope you will listen and integrate what some of these guests have said. By all means, please share across your social media, write a review, and if you go to the show notes page, you can find all the references for today's guest. You've been listening to Dr. Justin Trosclair, giving you a doctor's perspective.